This is the third video in the scientific revolution. Last video, we talked about the great thinkers, the roots of the scientific thought, and how it was applied to astronomy, the study of the sky, the stars, and the universe. In this video, I want to focus on how the scientific revolution affected medicine and health care. Before the scientific revolution, many practitioners of medicine relied on theories that were centuries old and rarely based on anatomical research or observation. Medical treatments were at best ineffective and at worst lethal. In addition, the church banned dissection, a practice critical in understanding the human body and how illness affected it. So no autopsies, no studying of the human anatomy. You're not allowed to do that under the church rules. In general, the church viewed sickness not so much as a physical disorder, but as a spiritual punishment for sin. Correspondingly, human intervention was seen as challenging the will of God. If you tried to treat a sick person, you were challenging the will of God. Much of Galen's work was based on Hippocrates, the Greek physician often called the father of medicine. In On the Elements, according to Hippocrates, Galen refined Hippocrates' ideas on bodily humors. The ancient Greeks believed that the human body was made up of four fluids: blood, phlegm, yellow bile, and black bile. An imbalance of these fluids could cause sickness or death. The theory of bodily humors inspired Greek, Roman, and medieval medical cures, including bloodletting, bleeding a patient in order to draw off an excess of a certain bodily humor, forcing vomiting, and various alchemical potions. Galen also believed that there were different types of blood in the body and two different blood systems, the veins and arterial. The venous and arterial. Venous blood was created in the liver, while arterial blood was created in the heart. Blood brought pneuma or spirituous air throughout the body and was eventually used up, so it did not return to its place of origin for circulation. It was not known that the heart played a role in the movement of blood. Rather, doctors believed that the pulsing energy of the arteries themselves caused the blood to move throughout the body. Galen later produced a 17-volume work titled On the Use of the Parts of the Human Body. He based his conclusions in the book on research he had conducted on animals, many apes. Consequently, On the Use of the Parts of the Human Body contained many errors, especially concerning the internal organs. For all his mistakes, however, Galen's medical theories remained the standard for over 1,000 years. During the Middle Ages, the Catholic Church assumed responsibility for taking care of the poor and the sick. Consequently, the Church also became the acknowledged authority on which medical practices were acceptable. Many lower ranking clerics took on physician like roles since they were usually the ones charged with directly dealing with the sick. Church leadership was uncomfortable with this development because clerics who practiced medicine tended to shirk their religious duties. The church began to pass canon laws that both regulated and limited the involvement of the clergy in the practice of medicine. Eventually, with the rise of universities, trained physicians began to replace clerical physicians. So your priest was your doctor. Andreas Vesalius, Andreas Vesalius pioneered the modern study of anatomy and wrote the first complete anatomy text on the fabric of the human body. Published in 1543, the work consisted of 7 volumes illustrated with fine engravings based on Vesalius's own drawings. He had gathered information for the text largely through the many dissections of human cadavers he had performed. On the fabric of the human body, corrected many of Galen's errors and revolutionized knowledge of human anatomy. William Harvey. In 1628, English physician William Harvey wrote on the movement of the heart and blood in animals, a work based on years of observation and dissection of both animal and human subjects. In the book, Harvey argued that blood was pumped through the body by the heart and constantly circulated. He also proved that the same blood flows in both veins and arteries. Harvey's conclusions disproved Galen's theories and created a basic model of blood circulation that is still recognized as the standard today. Here are some discussion questions about the scientific revolution and its effect on medicine in the medical field.